Hello, I'm Dr. Marla Shapiro, and I sit on the Board of Trustees of the International Menopause Society. And today we're going to be talking about the concept of impending menopause and fertility preservation. And to that end, I'm joined by Dr. Duru Shah. Thank you so much for joining us. Can you please introduce yourself to our audience?
I'm Dr. Duru Shah. I'm from India, and I'm the chair of the CAMS, or the Council of Accredited Menopause Societies, and which is part of International Menopause Society. I'm also a consultant gynecology and fertility expert at Gynec World in Mumbai, India.
Okay, so let's start off with the notion of what impending menopause means. So what is the definition? And then who is at risk?
The definition of premature ovarian insufficiency, as we call it, for impending menopause. And that is something wherein the woman is less than 40 years of age, and she has reached a stage where she's not getting her periods for more than 4 to 6 months. And her factors, all her blood work, etc., shows that she's almost menopausal. So she's actually just reaching there, and that's when we determine that she's got this problem. So that's the definition of premature.
Okay, so then how do we determine who the woman at risk is?
The woman at risk could be due to various reasons, and I think a lot depends on whether genetically she's carrying a gene which is running in the family, wherein even her mother reached menopause earlier. That's one. Second thing is that it could be some autoimmune disorder, which is something which is existing and damaging her ovaries, which are packing up much earlier. And the third reason could be because of a habit of smoking a lot, or maybe exposed to some kind of radiation, or that is more like a iatrogenic problem, wherein she's taking treatment for cancer and she's being exposed to radiation or chemotherapy, where the ovaries get affected.
And so when we think about menopause, we think about the fact that if we think of our ovaries as factories that have all our eggs that are sitting there, we're losing those. So there's this notion of something called ovarian reserve. Can you explain what that means for all of us? What does that mean?
See, the ovarian reserve is actually estimated in those women who come to us for fertility treatment. And they are at an age which is, say, probably an advanced reproductive age, is what we call beyond the age of 35. This depends again on the ethnicity of the population. Like in India, women reach menopause at 48, 49, whilst in the US or maybe Europe, they would reach menopause at 52, 53. So we reach menopause earlier, and therefore when women come to us at 37, 38, we are worried about them being able to conceive. So there are certain tests we do to determine whether they have sufficient eggs in their ovaries and whether those eggs are of good quality. Because as age advances, the quality of the eggs gets worse and worse and deteriorates. So that is what
well, I was just going to say that when you talk about advancing age, most women don't think of themselves as advancing age over the age of 35. But from an ovarian point of view, 35 really is a landmark year, if you will.
Yes, absolutely. Actually, that's what I'm saying, that the ovaries age much faster than your chronological aging. And this is something we must understand, because today women are into careers. Women are wanting to, postpone their pregnancies. They're getting married late. And therefore, we need to understand that there is a certain age in which your chances of getting pregnant are the best. And therefore, today, when young women are leaving jobs because they want to have their families much earlier, there are instances where the companies are offering them, the facility to freeze their eggs so that they can have their pregnancies even at a later age, and they don't have to be pregnant.
So let's talk about that, because often, even though we might know that under 35 is ideal to become pregnant, it may not just be feasible with your life, your career, your opportunities, your circumstance. So we talk about freezing eggs, and sometimes women hear the phrase freezing my fertility. So what does that mean, and what type of options are available?
Oh, there are brilliant options today. As a matter of fact, we would freeze eggs by stimulating the woman with injections so that many eggs develop at a time in the ovaries, when normally only one egg develops every month. So we give them injections, get eggs ready, take her into the OT when the eggs are sort of ready or mature, get them out, aspirate them out, and then freeze them.
Right.
That's what we, she can use it whenever she wants those eggs, when she's got a partner in life who's, and she's keen to have a baby. That's when those eggs get fertilized with the sperm. Embryos are made and put into her uterus. So it works brilliantly, and that's what we've been doing quite a bit now, freezing the eggs. And there are other methods also of freezing fertility. But this is the...
So when we talk about that and we talk about the difference between freezing an egg versus freezing an embryo, there's a notion that freezing an egg may not be as successful as freezing an embryo. So what are the success rates of pregnancy? Let's say first, if a younger woman is coming in or in her mid-30s, worried about her ability to get pregnant and wants to freeze her eggs, what's the likelihood that when she comes back, whenever she does come back, that there will be success?
No, in the past, the freezing facility wasn't great. It was slow freezing, which didn't give good results. But now when we do vitrification, we get excellent results. There is no issue. We hardly lose any eggs, maybe a small percentage when we thaw them. But yes, if you compare freezing eggs to freezing embryos, I think freezing embryos do better because they're probably more sturdy because of the sperm being in it. And the pregnancy rates and the success rates are slightly better with the embryos as compared to the eggs. Now, the question remains is if a woman hasn't found a partner in her life, at least in India, most of the girls do get married by 30, 31, but career women don't. And so they lose out on getting the right partner because those right partners are already married. So then they're in a hurry because, I need to get pregnant, I need to find a partner. They may find the wrong person to get a baby with. So therefore, those women who are the right women, when they come to me, I tell them, you're 32, 33. You're not dating anybody. By the time you date somebody, you're sure you want to have a baby through him. It may be another year, another 2 years. So this is the right time, freeze your eggs, and then you can take your time in finding the right partner and then get
So
married.
generally then, the younger you are,
yes,
the more likely you are to be successful in the number of successful egg retrievals.
Absolutely. The numbers are more, the quality is more. As a woman ages, if you see the normal physiology is a woman is born with a certain bank of eggs. And those eggs are released every month once she reaches puberty. And through her reproductive age, she may have approximately 400 menstrual cycles. And in between, she may get pregnant. But with every egg which grows, there are another 20 eggs which grow along with it. But when that one egg grows further, those 20 eggs settle down or they get atretic, they are lost, and it's only that one egg which grows. So these 20 are boosting that one egg to grow up and then self-sacrifice. So every cycle, you're losing so many eggs, and therefore the best ones come out first. What remains are the aging ones which remain, and therefore the fertility definitely reduces as the age advances.
So depending on what country you're in, for example, I'm in Canada, the cost of freezing eggs can be quite extraordinary and very expensive. It's not necessarily covered by health plans that are run by, in Canada, provinces, or health plans that may be run in the United States. So the costs can be quite prohibitive in some countries.
Actually, in our country too, nowadays, career women are quite happy to freeze their eggs. But I'll tell you one thing that when I was the president of the Society of Assisted Reproduction, I approached the government and I told them, you need to help women improve their fertility. And therefore, WHO has counted infertility as a disease today. I convinced And now they have convinced the insurance companies to cover fertility. And that has started in the last 2 years quite well. And gradually, there will be instances where there are many corporates who are helping to retain their good clients or their good workers, not clients, good lady workers who are otherwise leaving, and they are offering them the help to freeze their eggs.
Which is exciting news. So I think the notion for our women who are listening about freezing my fertility is an age-related event, And that message has been clearly heard today. Thank you so much for joining us today, Dr. Shah.
Thank you so much for having invited me. Thank you.